So what is the difference between Medicare and Medicaid then?
Medicare is for, like you said, predominantly 65 and older, or if you've had Social Security disability for 24 months, you're entitled to Medicare. Medicaid is the lower income health insurance. So you're eligible for Medicaid, you're eligible for insurance through the state usually. Medicaid is always regulated by the state.
All right, we ready? We running? Welcome back to the Just Build Baby studio. You're listening to the BuildX podcast, your ultimate guide to creating exceptional homes, innovative living spaces, and staying informed on all aspects of residential building technology. I'm your host, Buzz Artiano. Today we're excited to have David Dupuy Jr. in studio with us. David is the owner of Senior Healthcare Advisors with 15 plus years of experience in the health insurance industry and 7 years in Medicare. David, welcome to the show.
Thank you for having me. I appreciate it.
Yeah, I know this came together pretty quick, so I'm excited to have you on. This is a topic, obviously, a lot of my listeners are going to be interested in. So let's talk about pre-senior healthcare advisors. Kind of take me from where you started to how you got into this.
Yeah, my career path. So I worked for a company called Complete Payroll Solutions.
Oh,
I was
yeah.
actually with them for 20 years.
Wow.
So I started back in 2000, I want to say like 3, I believe, right around when the Red Sox won their first title.
They broke the Bambino curse.
Or I should say when my first child was born, so 2003, that would be more memorable.
Yeah, you know.
So I started there, and one of the reasons that I went there, they were a small, obviously at the time they were a much smaller payroll company, and they were opening up a benefits division, and I said at the time, hey, if I go to you guys and sell payroll, do you think I could sell health insurance as well? Because theoretically we're a smaller company, we're not going to get the same amount of volume, and plus it'll help me diversify my skill set. And they said, yeah, you know, come here. We'll have you do the payroll, and if you pass the health insurance and show us that you can sell it, then we'll let you sell it. And so they were true to their word. They let me. I passed it. A couple years later, I didn't do it right away. Passed the health insurance exam and worked with them on both the payroll side and the health insurance side for like 19, 20 years. And about 7 years ago, I remember losing one of my small groups. I didn't lose many small groups, so I kind of called back and said, hey, what happened? And they said, oh, somebody came in and helped us with somebody on Medicare, so we decided to go with them for the health insurance. I thought nothing of it till it happened like a month later.
Another one, you mean?
Yeah, another one. Same reason.
And these were group insurance policies?
These are small groups. One was like 5 employees.
Yeah.
The other one was like 7 employees.
Yeah, okay.
But now it's a trend. Like, one is, whatever, I don't touch that space. 2 is like, well, what's going on now? And so I looked into it, realized that 10,000 people a day are turning 65 until 2030. And I'm like, there might be something to this. This might be something that we have to take a look at. And I went to the head of benefits, and I'm like, hey, what we should do is Medicare. And he had his plate full. I mean, we sold group health insurance, 401ks, and benefit administration. And he's like, I'm not doing Medicare. He's like, if you want to do Medicare, we get asked questions all the time. We're happy to direct that traffic to you so you can talk to people and, be our arm for that. And I said, all right, I'm going to go get licensed. I'll let you know when I do. He's like, let me know when you do. I did, and they directed everything towards me.
So you decided to leave then?
So no, I haven't left yet.
Okay.
Now I'm still doing the payroll and the group health.
Yeah.
And then I'm doing the Medicare
Got
slowly
it.
On the side.
Got it.
So the whole business is, I always say, like, I'll just do this brick by brick, which is person by person.
Yeah.
And so, it's not a lucrative business by any means when you get a few people. It only really starts to make money when you get hundreds of people.
Yeah, so scale. You got to scale it. Yeah.
And so I knew it was going to take a while. So I did both the payroll, the group health, and then the Medicare stuff. And they were wonderful, for number one, for allowing me to do it. But number 2, for feeding me, too. I mean, they would get all kinds of questions and use me as a resource. And 3, I was able to kind of tie in the Medicare conversation with the payroll and group health insurance conversation. You know, it's a value to many companies, small and large. So I was able to kind of tie that in, and it helped me on both sides of the house. And then probably about 3 or 4 years into it, Complete Payroll sold the business to iSolved, and then things started to change. It wasn't,
I know all about that.
The same.
Yeah.
You know, the first lie they tell you is nothing's going to change, and then everything changes.
Yes.
But it took a little bit of time.
Yeah.
Stuck with it, and then when it really started to change, I was like, you know what? I have a big enough business that I can stand on my own. I'm going to just go for it, and haven't looked back since, you know.
Okay, so that was your tipping point. You probably would still be there doing what you were doing unless they got sold. Or you were already
I was
thinking
on
about
a
it?
path where it was starting to occupy, because I had so many clients now.
Sure.
It was occupying so much of my time.
So you were already on that trajectory.
I was on that trajectory.
And then they kicked you over the side.
And then they just pushed me over to the side.
Yeah.
You know?
Well, thank you to iSolve.
Yeah, I mean.
Good job.
Yeah, thank you to Complete Payroll, really.
Yeah, 100%.
The owner who I'd worked there for 2 decades, and the head of benefits, like 2 tremendous guys, great role models, you know. I went in there, I think I was like employee number 7.
Wow, so you were in early.
I was in early, and when he sold, I think he had like 170 employees.
Wow.
So I was able to see that company
Yeah.
and participate in the growth of the company, which, you know, has only helped me as I do my own thing here.
Yeah, awesome. All right, so then how did you decide? What was the day you decided? Was it like a lightning bolt, or was like, okay, I'm doing it today? Well, how did it go? I'm always curious about this part.
So,
you woke up on a Saturday?
No. So after work, me and my wife would walk, and we'd do a 3-mile walk every day. And it had been pushing me there anyway. And this is like mid-August.
Yeah.
So I'm like, just in the middle of the walk, I'm like, hey, do you trust me? And my wife's like, yeah. And I'm like, I'm quitting my job.
Yeah.
And I'm like, I'm going to do this full time. And she just like looked at me. I'm like, we'll be okay. You know, we're going to take a step back. But, you know, in the long run, it'll be better for all of us. And, you know, it's just something that I wanted to do.
Yeah.
She knew I was already on that path.
Yeah.
But literally on that walk is when I was like, I'm done.
So you remember that like it was yesterday?
Yeah, I do.
Yeah.
Yep.
Yeah.
And I'm like, I'm done. I'm doing this. I'm gonna take off my life vest and, you know, swim alone. And
so you
that's
married, kids at the time, little kids?
Married, kids. So my kids were, my kids are in their 20s now. They were just.
So they were little.
No. This is recently on my own. It's only been a couple of years standalone.
Oh, okay, all right.
Yeah,
So Senior Health Advisors is fairly new.
Yep, 7 years in.
So they were 15 teenagers then.
When I started?
Yeah. So that was a brave move.
Yeah.
Thinking about college coming up and first cars and all the things that go with that, right?
Yeah, I mean, it all factored in, but one of the other things is like, number one, how can I become better at my job?
Mm-hmm.
And 2, how, you know, for me, I had started my career, believe it or not, as a recruiter. So I was a headhunter for high tech. And one of the things I noticed in high tech is, like, your skill set moves you along. Period, end of story. It has nothing to do with anything else.
Right.
And I saw a lot of people that never adapted their skill set, and then they became
obsolete.
Yep. And I'm like, I don't want that to happen to me. That left a mark on me that I never forgot. And I'm like, I don't want that to happen to me. I'm going to continue to refine my skills and, you know, make sure that I'm learning everything as you go. I think it's like, and I do stress that to my kids now. But that is what encouraged me to, like, hey, I need to do this to help myself here.
Yeah.
And then 2, the owner of the company, you know, I'd been there at the time when I started thinking about it, 13 years. I'm like, he's going to retire one day. He's getting older, you know.
Every business is for sale.
Every business is for sale. And, you know, and then, of course.
Just a quick story. I had a PM come in the other day, you know, for an interview, and I told him I had, sold and exited 2 companies. He's like, "Oh, I can't work for you. You're going to sell the company again." I said, "Yeah, it's public knowledge." And I said, "The company you work for right now is for sale. You just don't know it because the owner's not brave enough to tell you."
Yeah. Yeah. It's just the nature of the beast.
It's just a matter of time.
Yeah. Yeah. It really is.
Yeah.
So that's when I was like, let me develop not only the skill
Less
set.
than 10% of businesses go to the next generation.
Really?
Yeah, and less than 2% make it third.
Really?
Yeah.
Yeah, I didn't know that.
Yeah.
Yeah. I did know they were similar numbers, though.
Yeah.
I
It's really
did
low.
know it. Yeah. I can see it, though. Like, you can understand it.
It's hard.
People want to carve their own path.
Well, that and, not, who knows? Your kids they're interested in something else.
Yeah, exactly. I'm
right?
already going
Or
through
they've already, they've already seen you go through the trials and tribulations, and they think the grass is easier somewhere else.
Yeah.
Right?
Yeah. Good luck to them. It isn't.
Yeah, that's another podcast. All right, so now we're at Senior Health Advisors. So this company is, 3-4 years old?
7. No,
Oh, 7. Okay,
yeah,
so 7 years
really.
old.
Yep.
And so I'm going to be honest with you. We're going to start from the beginning. What is Medicare? Who is it for? What's the difference between that and Medicaid, which you just educated me, but obviously we're going to need that on film. So I'm going to let you kind of roll with it.
Yeah, so Medicare is health insurance for predominantly people that are 65 and older.
Okay.
When you turn 65, you become eligible to go on Medicare.
And what does that do for you?
So what that does is it gives you access to government insurance.
Okay.
All right.
But what if you already have regular insurance?
So it depends on how you have the regular insurance.
Okay.
So if you have regular insurance through an employer, now it depends on how big that employer is. So if that employer is 19 employees or less, then by law Medicare is primary. If the employer primary. So what does that mean? So that means that some carriers might say, "Hey, your small group got to go on Medicare, or we're not going to cover
The whole
you."
group?
No, just that particular participant.
Okay. And what about that participant has a wife and children?
So if they have a wife and children, usually if they move them to like a group Medicare, because 19 or under, you can also put in a group Medicare where the employer can fund it, then usually the insurance company will say, we'll have your dependents on as if they're subscribers.
Interesting.
Yeah.
So they stay on the regular insurance.
Correct.
And then that other person goes on the Medicare.
Yeah.
Now, does that person have to do it, or what's the reason to
So they
do
don't
it?
have to. Sometimes the insurance company's going to, make them do it.
Because it takes the risk off of them?
It takes the risk. It takes the risk and the claims off them.
Got it.
And those insurance company knows that most of their claims is going to come from the older segment of the census and of the group.
Yeah. Okay.
So do they have to? So they technically don't. It depends on the insurance provider.
Sure.
But let's say you go on it, and I've actually seen this happen. Let's say let's say you go on, you stay on it at 65, and you're healthy as can be, and the insurance company has no problems, and then all of a sudden you get sick.
Yeah.
And let's say it's something like a cancer and it's expensive. Well, now that insurance company actually by law has the right to say, no, Medicare is going to pay first. You should be on Medicare and deny the claims.
Really?
So that's why I always tell people, listen, 19 or less, do you have to go on? You're not going to get penalized by Medicare because you're on group health insurance.
Sure.
But you should probably think about it because technically that carrier, whoever you're with, does hold the hammer. So they can say...
So in the middle of you being sick, they can decide to push you off.
Yeah, they can. Do they? Not usually. But I'll tell you what, if you're sick and they just happen to deny the claims and tell you should be on Medicare, you'll probably go on Medicare.
Yeah, 100%.
Yeah. Like you'll be in fear.
They've got the purse strings, so
Yeah.
you're going to go where they say you to go, right?
Yep. And so that's
fascinating. So what if you're 19 or more?
19, so 20 or more.
20 more.
Rule of 20, call it. Medicare rule of 20. 20 or more, the group health is primary. Period. End of story.
Okay.
The Medicare is secondary. You don't have to go on either A or B. So there's two parts.
We're going to get to that. I know there's two
So you
parts.
don't have to go on anything if you don't.
So
if you don't
Medicare
choose.
is essentially regular insurance that's a group plan funded by the government.
No, it's individual government insurance
Individual.
for those that are
But
predominantly.
it's a giant group of all the people on it, though, essentially, Medicare.
Yeah,
Yeah.
but it's very individualized
Okay.
because a husband and spouse can go on Medicare and have two different secondary plans.
Really? Okay.
Yeah.
So we're going to get really into the weeds here.
If you want to.
I don't know if I can take it, but
Yeah,
we're going to try.
Neither do I.
We're going to try.
No, I'm kidding.
No, we'll be good. So what is the difference between Medicare and Medicaid then?
So Medicare is for, like you said, predominantly 65 and older. Or if you've had Social Security disability for 24 months, you're entitled to Medicare.
Okay.
Or if you have something like ALS or kidney failure, then they'll expedite the Medicare even though you're not 65.
Okay.
Okay? So that's Medicare. Medicaid is the lower income health insurance. So you're eligible for Medicaid. You're eligible for insurance through the state usually. Medicaid is always regulated by
And
the state.
what's that income threshold? Do you know?
Ooh, that's a great question. In my office, I have a chart, and I could tell you, point to you the
you didn't
different
bring the
levels.
chart?
I didn't bring the chart with me. It's a sliding chart depending on how many members of the family are there.
So there's a formula that you have to follow.
Yeah. Yep.
All right, so I'm going to play some what-if scenarios, and I'm going to pretend that I'm your customer. And I think this will be a lot more applicable to people watching,
Yep.
especially people that are 65 and older.
Yep.
So I'm going to just pick on, random Jack. So Jack is 64.
Okay.
He's about to turn 65
Yep.
soon, 5-6 months. And he's married.
Yep.
His wife is 55. And they still have a couple of kids that are under 20. Is it 26 for health
Yep.
insurance? Yeah. So they have a couple kids under 26 and a couple that are older. And he's in a group plan with 12 other people at his work. So now what?
Okay, so my first question is, you said 12 other people group plan. How
Yeah.
many employees are at that employer?
We're going to just use easy math, 12.
12.
Let's pretend everybody's
Right.
on insurance.
So now what is, I'd probably recommend to him,
So we're going to say to Jack,
you should probably consider and take a hard look at Medicare. Let's see if your insurance carrier will
what would
cover
the
you.
reason he would not want to do it?
Well, just for what you said, he's got dependents. So a lot of times, there's dependents and they don't want to do it. Or let's just say the group health plan's a very rich plan.
Like a good plan, you mean?
A good plan and the employer pay. Let's say the employer pays 100%.
Ah, okay.
Okay, now I don't want Medicare. Why do I want to go incur my own costs if my employer is paying all of my insurance?
All right, so that's a good point. So let's play some what ifs here.
Okay.
So Jack's, I'm going to just use round numbers here, and these numbers are not applicable to anybody. This is just a made-up number, but simple math for me.
Yep.
So Jack's paying $3,000 a month for his insurance,
Yep.
for his family plan,
Yep.
okay? And Jack is 64, his wife's 55, and he's got a kid at 20 and a kid at 19,
Yep.
okay? And they're in a family plan. The employer is paying half, so they're paying $1,500 a month, and Jack's paying $1,500 a month out of his payroll. Okay, and just for simplicity's sake, the wife doesn't work, and the two kids are in college.
Okay.
Okay, so I go to my insurance company. My insurance company says to me, "Now, can they force me to go on Medicare?"
No, they can tell you can go on. You have to get Medicare because technically Medicare is primary. So they can tell you to go get Medicare. It's primary. Now, depending on your carrier, you'd call the carrier, give them that situation and say, can I remain on the group plan? Is there going to be a problem? Or do I have to go on Medicare? And if I go on Medicare, are you going to allow me to have the dependents as, your spouse becomes the subscriber?
Yeah.
Okay.
So let's pretend that they say you have to go on Medicare, Jack, but your spouse and the 2 kids can stay on the regular plan.
Okay.
All right?
All right.
And again, I know this is going to get tricky, but I think this is important. So now the $1,500 stays with the kids and the wife.
Okay. So he gets no break on that.
Correct?
Yeah. Because it depends on.
It's still a family plan. He probably doesn't get a break.
It could be
a single spouse, 2-person.
Yeah.
Let's pretend you don't get a break.
All right. That's fine.
Again, for easy math. I know it gets complicated, but let's pretend. So now Jack has no insurance through the group plan, through the business group plan, and now he has to go on Medicare.
Yep.
And Jack has to pay that 100% himself, correct?
No. So under 19 employees, the company can pay for his Medicare. And then they can actually pay for, so what he would need to do is get Part A and B through the government.
Yeah.
He'd pay for his Part B.
Yeah.
That would be dependent on his income.
Okay. So let's pretend he makes $150,000 a year.
So he's going to pay $185, which is the base rate per month.
So $200 a month.
Yeah.
Yeah.
And then the employer can pay a group Medicare plan, which would probably cost the employer, or both the 2 of them combined, call it $350 a month. That'll include a prescription drug plan on it.
Okay.
So now you're at $550 for
Yeah.
just him.
So, and he's paying, but
And the employer can subsidize it.
okay. So they can also decide to kick in half.
Yep.
Okay. So it sounds like in my scenario, it's going up somewhere between $300 and $400 a month
Yep.
for each side when you hit 65.
Yep.
Is that a fair assumption?
Yeah, unless they have tiered where it's
Yeah. But I mean, all things being equal, it's going to be more expensive.
correct.
Maybe.
The,
But that's what they need you for, right? So we're going
that's what they need me for.
right. So now I come to you. So let's pretend I just walked in the door.
Yeah.
Hey, David, I got this mess. I'm turning 65. Blah 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 blah. Tell me what. So I'm a new customer. I'm walking in. I'm Jack,
Yeah.
right? Hey, how are you? Nice to meet you. Here's my scenario, David. How can you help me? Now tell me what that looks like when I come see you.
I'd ask all those questions.
And more.
And
And you
then
want to see my insurance.
Correct.
Blah blah blah. Right.
Yep.
So lots of deep dive. So you do now. Am I meeting with you? Or am I meeting with an associate? Who am I?
You meet with me.
Okay.
Yep.
So I'm meeting with you one-on-one.
You're meeting with me one-on-one, and I would ask all those questions and then some. Like you said, I want to see.
Now, is this a face-to-face, or are you doing a Zoom, or?
So I have a physical location now in Hanover, Mass.
Yeah.
So you can come to me. I still sometimes go to clients. I mean, I'm local in the area. I live in Middleborough. I
Yeah.
commute to Hanover. If you're in between, I could maybe
Yeah,
make
probably
the
stop
time
in.
and
Okay.
stop in.
All
I
right.
built the business.
So
when I
this
was-
is, I'm dealing with you
Yep,
the whole way.
the whole way.
There's nobody else helping you.
No,
Okay.
but that's fine because
No. That's important for people to know
Yeah.
because when they go somewhere else, they get intake by one person, then they get shuffled over to this other person, then they talk to someone in Charlotte, North Carolina that supposedly knows the laws here, and then they go over this way, and then they become a number, and then this goes here, and then eventually they get an answer. Maybe it's the right one.
So
If I come
so
to
where
you,
would they go in that? I'll tell you where they go. Let's
Yeah.
say they go directly to the carrier. Exactly what you just described
Yes.
would happen, and they'd only be given the perspective of that one carrier.
correct, yeah.
So
Because
what
the carrier only cares about themselves.
Correct.
They're following the law. We're not saying they're breaking the law.
Nope.
But they're giving them just enough to meet the law and nothing more.
No, because Jack, if he calls the carrier, is probably dealing with somebody who's
Yeah.
got 2 years experience.
And they're
selling
reading off a
Medicare,
script. Right.
And they have to make sales. So,
100%, yeah.
So like,
Yeah. No, I'm not saying they're doing
You
anything
know.
bad. I'm just trying to point out for
and
people
don't
the
get me
difference.
wrong, I have to make sales too. Obviously, we
I
all
get that,
do.
but I'm trying to point out to people in this discussion here is when I come to see you, you are the guy that I'm going to meet with, and you're going to give me all the options.
Yes.
Right? And you're
Correct.
going to understand my story, and you're going to look out for my best interests. You're not looking out for the carrier. You're not looking out for the business. You're looking out for Jack.
Yeah, I represent both parties, the carriers and you.
I understand.
And so, yes, I'm looking to put my clients in the best optimal
Right.
optimal
Yeah. No,
position
we're
that
not
we
breaking any laws. We're just making sure that we've looked at all the options and made sure that we can do the best we can do for Jack.
can. And so, one of the things that I would say to Jack is, will your employer pay any of this for you? And so
So you're going to give him some homework too.
I'm
He's-
going to give him some homework.
Yeah.
I'm absolutely going to give homework.
Now, are you, once he comes to see, I know I'm jumping around a little, but this is coming to mind. And yes, I know I'm a pain in the ass. So when he comes to see you, does he sign anything where you can talk to the carrier as well?
So before he comes to see me,
Yeah.
I have what they call a scope of appointment,
Okay.
in which I need him to sign, which just says that he and I are going to talk about Medicare and health insurance plans only. Like, it's a big no-no for me to ever bring up life insurance, long-term
Understood.
care, or any of that.
Yeah.
And
You're
that
strictly
form
there.
needs to
Yeah.
be signed, 48 hours prior to our meeting.
Okay, so there's some serious regulations around
Big
this.
time compliance.
Yeah, understood. That's good to know.
Yep.
So if someone's not asking you for that form, you're going to the wrong place.
Well, they won't ask for it because they don't know about it, but I will tell them, hey, here's what you got to do.
No. In other words, if they contact someone else to help them with this problem, what we want people to take away from this podcast is that there's experts that know what they're doing, and then there's everyone else,
Yeah.
right? And that's why you're here, because you're the expert.
Yeah.
So my point was, if they call Jimmy's healthcare insurance, and Jimmy says, yeah, come on in, and he didn't ask about the form, there's strike one.
Yeah, they should be aware that form needs to be
Right,
signed.
right.
Yep.
Yeah.
Yeah.
But trust me when I tell you, there are lots of places that need to know a lot of things that they don't know.
Yes, I trust you. I believe that. That's for sure.
So 48 hours, he signs a form,
Yep.
and then once he comes in, on the homework side, are you allowed to help him with the homework? Can you call the carrier and talk to him about it?
So here's what I do, right? So before they come in, and I know in today's world, you're older and sometimes it's difficult, but I got to tell you, I have a super duper high success rate. There's actually a link I send to all my prospective clients and current clients. The link means you're going to click on this link, you're going to fill out data with your name, date of birth, address. You're going to need to give me your doctors and prescriptions,
Yep.
and then at the end of that form, you're going to sign that form I just talked about.
Okay.
So once they complete that, take them 15 minutes, that comes to me securely, and then I've got all their info in front of me. Sometimes I include an additional link that takes a few minutes. That's just like, is there anything else you want to talk to me about? Like, let me know going into this, because obviously, if you want to form your ideal solution, then you're going to want to tell me everything that you want covered
Sure.
on that plan.
Yeah.
So takes probably combined, you're talking 10, 15 minutes to complete forms.
Okay.
Now I have the data, so now we're going to sit down, and I already have a pretty good idea of where we can go with it. In Jack's situation, my first question will be like, hey, we've got all this data. Is your employer, who is under 20 employees, willing to throw some skin in the game and help you out because, maybe the carrier is pushing you to go on Medicare?
Got it.
And usually the employees are pretty good. I got to tell you, like, they take care of their employees and
Yeah, I mean, someone that's probably been at the company a long time, they're still there for a reason, right?
yeah.
Right.
And so they'll ask, and then I'll in that situation where it's under 20 employees, if the employer says we're willing to do this, then I would engage the employer too and kind of bring them in
Okay.
and say, all right, hey,
So
here's
you're
what
the
we're doing.
bridge in all this.
Yeah, exactly.
Okay.
Now, in some of those situations, so let's take away the kids, and let's say it's just Jack and spouse, like he comes off, and sometimes it's single in family like you described, instead of the tiered, like he comes off, it's a big win for both Jack and the employer.
Yeah, 100%, because now it's a single payer, which is probably less than half of what they're paying for a family plan.
Exactly.
Yeah.
So the math shows quickly, and they're like, of course we will. Like, let's
Yeah.
do it,
Interesting. And so how do you get paid? How do you make money on
I
this?
get paid by the carriers. I always get paid by the carriers directly.
So there's no fee for me to come see you.
There's no fee for you to come see me.
Okay, I don't have to give you a credit card up front for you to work with me, nothing.
Nothing.
Just fill out the form, come see you, and you're going to take care of me.
Yep.
Good.
Yep.
That's what I like to hear. So now there's always a downside to everything, right? So what's the downside to going on Medicare?
So great question, broad question. It depends. Everything, there is very few black and white answers in this
I understand,
business.
but there's some big downsides to everything. There's upsides and downsides.
Yeah.
It sounds like that. Well, let's do the upsides first. What's the upside of going on Medicare?
Well, the upsides is you get access to government insurance that's going to be very cost effective.
Yeah.
And most of the time you can probably get medically for less money what you're getting from an employer. And you can, if you're on the individual market, or if you have, now we didn't talk about that, but the individual market, or you haven't no insurance, you have to go on Medicare. By law, you have to.
That makes sense. Yeah, I understand. Yeah,
so that individual,
you can't run around without health insurance.
That individual who's 60 to 64, they're paying the highest premiums out there. So once they hit 65, they're going to save a significant amount of money and improve their plan. The other benefit is you got some really like broad coverage out there. So they're just from a cost standpoint, what you get on the benefit side, it's usually pretty good. I mean, for the most part, it beats a lot employer plans. Many people assume my employer plan is better, and it's like not necessarily.
Interesting.
You know?
I would.
Lot of times,
my initial reaction was it's going to be less of a good, a lesser plan.
That's exactly the way everybody feels.
Yeah.
But 90% of my clients are coming off an employer plan.
Really?
Yeah,
once they see the numbers.
New to Medicare, once they see the numbers, or they're just in situations. Now, I chase a certain demographic, meaning I chase people that are in the process of retiring, or I'm going to do seminars at larger companies that might say, hey, maybe I should engage David and just see if it makes sense for me to come off the plan.
Sure.
And now, as an employer, you can't entice or force any employees on the plan. But what you can do is say,
offer them education. Right.
I want you to talk to David.
Yeah, 100%.
I'm going to have David call you, and then I don't even need permission to call because I got it from the employer. And then I would engage them and say, hey, let's do an apples to apples. And I think that's what kind of where I've been able to excel is because 15 years in group health insurance, it helps me know exactly what they have and exactly what they're getting. So we can do an apples to apples. And, now what's the downside?
Yeah.
The downside is, let's say you're on a rich employer plan and you don't necessarily want to come off. Some employers.
So I'm on a plan. I'm getting 100% covered by the company. It's got really low deductibles. Everything's covered. Go whatever I want. Dental. It's got everything in it.
Yep.
I'm going to lose all that.
No, you're not. So that's a big misconception right there.
All right.
So you can come off Medicare, but just because you go on to Medicare and lose the health insurance piece of it, the dental, vision, and all that, you can stay on those.
Oh, at the company?
Yeah.
Because there's separate coverages.
Yep. A lot of people don't take that into account.
Yeah.
Well,
that's
tell them, hey,
that's why I have you here.
Yeah, and I'll tell them like, hey, what do you get dental there? Especially vision. Like if you're getting vision in a large company, the bigger the better.
Right.
That vision plan's probably a lot stronger than you're going to be able to get on the individual
100%.
marketplace.
Yeah, 100%.
It's not even going to be close.
Yeah.
So I'm like, hold on to those things if you're not going to retire. Now I get a lot of retirees too. That's the avatar I chase is people that are retiring.
Or about to retire or retiring.
Yes, that's where I really want to, meet people. Even if they're not Medicare eligible, because I do the individual health insurance, then I still want to talk to them. So if they're 58 to 64, I still want to
they're
talk to
retiring
them.
prior to 64, 65.
Yeah, because the number of calls I get that are like, hey, I'm 65, I want to get out of here, but I have no idea what health insurance is going to cost me.
Interesting.
Can you give me an idea?
So that's keeping them working because they're afraid of what healthcare looks like.
It's keeping more people working than you think. That is probably one of the
that's
top
fast.
things.
Yeah, that's fast. I didn't even think of that. This is some good stuff. Yeah. So all those things. The first call for most people then is to call you.
First call. No. So here's how I've built my business.
All right. Tell me how we do it.
It's really in 3 buckets.
Yeah.
The top bucket is they call their financial advisor.
Okay.
And I'm going after the financial advisors because 99% of them
they're going to say
Medicare.
call David.
Then it's call David. So I'm the second call.
All right. We call the financial advisor.
You call the financial
And he says, I only know stock market investing. I don't know anything about Medicare, Medicaid, or I don't know anything about this. You call David. He's my expert.
Yeah, because the number one concern for people that are about to retire is, am I going to run out of money?
Yep.
So I'm going to call my financial advisor.
Yeah. And number two, how am I
going to get health insurance and how much is it going to cost? Then you call me.
Yep.
So I'd be high in that. The other thing is I deal with a lot of large group brokers because they get asked about Medicare all the time, just like my former employer.
Yep.
And they don't have resources to go to.
Yeah.
Like, hey, I don't know.
So again, it's this very specialized thing that if you don't do it all the time, you're going to do it wrong.
Yeah.
I mean, that's the bottom line.
And doing it wrong can be costly.
Yeah, or deadly.
Yeah.
Right? Or deadly.
Yeah. And then the third way is I'll reach out to companies to do and offer seminars.
Sure.
So a lot of times they'll have me in and we'll talk about Medicare. I've also got my Social Security Advisor's certificate because 7 years ago when I started in Medicare, I got asked a lot of Social Security questions. I'm like, probably be good if I could answer a couple of these questions,
Yeah.
So I pursued that so I can handle a lot of people's Social Security questions because they're not necessarily siblings, but they're cousins that are closely related, and being able to tell, all right, this is where this bucket, this is how they work together.
Yeah, 100%. Yeah, that's why it's very similar to tying this back to the ADU. I tell people the first thing you need is someone like Patrick, who's a family lawyer, trust, all those things, and then obviously you come into that mix as well with that.
Yeah.
If they're to the age where maybe they're doing this young, and they're not on Medicare yet, they need to get involved with you as well. So there's a team that has to be in place because they ask me questions all the time, and the first thing I say to them is, I have no business even telling you one answer. Yeah. Never mind, I'm giving you the wrong answer. I'm just going to say, I have no idea. Here's a list of people to call that I know and trust.
Yeah. And the other thing is, even if they're on Medicare, let's say that they're moving from Florida or another state to Massachusetts.
Yeah.
That immediately is going to trigger your plans are state-based. They're actually county-based if you're on certain plans. Yeah. They're not going to necessarily follow you. Some will if you're in a specific plan. Most won't. All right?
No, so that's good for people to know. So if you're living here now and you're going to build an ADU here to just maybe be up here in the summers, but you're going to change your residence to Florida.
Correct.
Right, which is a common thing people do to save on taxes and other things. Then they got to make sure that they also tell you those things because that's going to affect what you're doing.
It affects their health care.
Yeah. Now, if they say that, can you still help me if I'm moving to Florida? Can you still be my guy?
Yeah, so I'm licensed in 19 different states.
Okay, and obviously
and Florida
is
one
obviously
one. Yeah. That was pretty early. That one had to come in. Yeah. Most of the states I'm licensed in are in the Northeast, the Southeast, and then I'm in California and the West Coast, all the warm areas.
So the natural progression from the cold to the better climate.
Yeah.
So
I'll take you a step further, believe it or not.
All right, here we go. Buckle up.
Let's say you live in Boston.
Yeah.
And let's say you're older and your children live down the Cape.
Yep.
So you're in Suffolk County and you move to
Barnstable
County.
Yeah.
Your plan choice is there versus there, depending on what plan you're on. That could vary.
Really?
Yeah. So it's even county to county, depending on what plans you're on.
Okay. So word of advice to people on. So that's a good question. So I'm already on Medicare, but I don't know if I'm on the right plan. Can you still help me?
Yeah, absolutely. As a matter of fact, great timing in the timing of this. Tomorrow starts the annual enrollment period. So that's between October 15th and December 7th. They can make whatever changes they want to the Medicare plans if they so choose. What you're going to see this year, and it's a huge concern.
Wait. Before you get to what's going to happen, I just want to be clear on this. So I'm in Boston. I'm building an ADU in Barnstable County, and it's done, and I'm ready to move. And I got Medicare from wherever. I didn't see you.
Mm-hmm.
I can call you up, and you can help me.
Yeah.
Okay.
Absolutely.
I just want to be clear for people to understand that.
Yep.
So now you can become my expert.
Yep.
And you say, okay, what are you doing? Let me look at your plan. This is, okay, you're moving here. This is your options. And you're going to walk me through that.
Yep.
All right, now tell me the thing you were going to tell me.
Now, what I was going to tell you is the annual enrollment period, you can also look at those options regardless if you've moved or not. You should look at it when you move. Moving is actually moving.
So you're coming into a very busy time of year.
Very busy, extremely busy, especially this year. This year more than any.
Because
a number of the Medicare Advantage plans out in the marketplace in 2025 are being canceled for 2026, and people are being asked, go find new plans.
Really?
Yeah. So it's expected nationwide that 1 to 2 million people are going to lose their plans. Here in Massachusetts, I would say that number is actually a little bit higher. Some of the carriers here have eliminated plans that were very popular that have affected thousands of people. So those people are now going to be forced to go to the marketplace and make these decisions. And depending on how they got it the first time, they may have somebody like me as a resource, or they may not.
Yeah.
Or
that person might have retired or sold or whatever, right?
Yeah.
Depending on how old they are.
Correct.
Now you can stay on Medicare until you pass away, correct?
Correct.
So once you're on Medicare, as long as you stay current and you pay attention with someone like you helping me, I'm okay as long as I can pay the premium.
Yeah.
Now what happens when I run? Does the premium go up as I get older?
Yeah. So the core premium is the Part B premium, which you get from the government. So you're going to pay the government their premium, no matter what secondary plan that you get.
Yeah.
And that does creep a little bit. Where currently the base rate today is $185. They're expecting it to go to $206.50. So that's based on trustees of Medicare saying we need to get $206.50 next year.
You think they would have just went to 207?
I don't know why. I don't know how they do it. When I first
No, they were in enrollment. Someone was saying 208, and someone was
Yeah.
saying 205, and they said, "I'll meet you in the middle at 206.50."
It's been quite a jump though, because when I first started, it was like 136, and then it went to 144.
There's a lot of people in older,
Yeah.
right?
So,
People are living
yeah.
longer, right? There's more advanced.
Baby boomers.
Yeah, more advancement in healthcare to keep people alive longer. Treatments, more advanced treatments that can be very expensive, right?
Yeah.
So all those things drive up the cost.
Yeah. So as long as you're paying the Part B, and you'll either, if you're not on Social Security, the government will bill you, and then you have to pay them.
Yeah.
If you're on Social Security, they're just going to take it out of your benefit. They don't
Okay.
give you the chance. You don't see it.
Yeah.
There's no line item. They just pull it out.
Yep.
But you do need to pay it if you're not collecting Social Security yet. So
Yeah. And when are you eligible for Social Security?
you're eligible for Social Security at 62.
Yeah.
And you can collect anytime from 62 to, whenever, but 70 is the max out age where you'd collect the most money that you can.
So if you wait to 70, you're going to get the most money per month.
Yeah.
So
Yeah.
after 70, if you don't collect it, you're just letting the government keep your money.
Correct. Yeah. Yeah.
So that's a good point. So is there any income limit on it?
When you say income limit, what do you
So
mean?
I'm 70 years old and I'm making $1 million a year on my investments.
So good question. Great question. There is an income limit, but it happens before 70. So if you collect at between 62 and let's say you were born, let's say you turn in 65 in January of 2026. 62, 63, 64, 65, 66, 67 is going to be your full retirement age. So what does that mean? That means that I am now allowed to collect Social Security The number that's there, let's just, for round numbers, say it's $3,000, is available to me, and I can continue to work and make as much money as I can without being penalized.
Really?
Now, from 62 until I reach my full retirement age, if I collect early, then I have a limit, which is very low. It's like, I'm guessing, it's like $28,000 or something that I can make, and then for every $2 I make, they take $1 of benefit away from me.
Yeah, I've seen that. I was aware of that.
So you really want to make it to your full retirement age, but if you're 70 and you're just about to collect and you're making $1 million, then you can make your $1 million and collect. No income limits.
Really?
Yeah.
Okay.
Yeah.
That's fascinating.
There's a lot to all these things.
Yeah. Now, is that something you advise on as well?
So I can help guide them in Social Security.
Okay.
I don't
and
have
then do you have an
software.
expert to send them to?
Well, usually like Social Security, you could add the license. You know, I have the license of doing it. I don't use the software. It's more of like, when do you think I should collect? Now, I usually urge a lot of people, because by the
So
point...
this is something, there's a portal I can go on and play What If myself?
Yeah, the portal's called My Social Security, and you can see what you're going to earn at what age.
Okay.
What I can do is advise, if you do it early, then this is what's going to happen.
Yeah.
If
So if you
do it
don't
till
need
full
the
time.
money, you bet, and you think you're going to last past 70, you should wait till the last moment to start collecting, or 67, you're saying?
I always say collect at 67 only because you don't know what the liquidity of the Social Security account is.
It doesn't matter, because it doesn't matter then anyways, because if that blows up, it's all over anyway. So
Correct. But like
that's a whole nother discussion.
The other thing is waiting those 3 years
Yeah.
means that to get that money back, you gotta live at like 15 more years.
Yeah.
Before you're even.
Right. Yeah, because
So-
you left 3 years behind.
Yep.
That even the increase, by the time the increase kicks in, you got to make it another 15, 20 years to get back where you were.
Yeah.
Right.
Yep.
So 67 is kind of that golden window.
67 is ideal because you reach your full retirement. You can make as much money as you want. You're not dinged prior. So if you collect any time before, for every year you collect before your full retirement.
Yeah.
it's
Now
it's
that
8%.
67 has gone up recently, correct?
67 is what I think it is today.
Right. So
I don't know if it's gone up.
Yeah,
I'm
I know.
sure it will.
I know it was it was a lower number than that 4 or 5 years ago. I do know
Yes,
that.
it was.
Yeah.
And they kind of,
Yeah, they
it was
creep it up.
66,
Yeah.
then 66 in 3 months, then
Yeah.
66 in 6 months.
Yeah.
Now it's 67.
So the
and that's
website
kinda-
someone to go to look at for that is what?
You open your account, My Social Security.
Yeah.
So we used to get, even younger than 60, we used to get mailed out
Oh,
Social
yeah, I
Security
do remember
statements.
that. Yeah.
So they stopped doing that. They will, if you don't have a My Social Security account, so you can go see it online, they'll start it again at age 60. You'll start to get the paper forms again.
Oh.
As soon as you open a My Social Security account, they stop.
Yeah, I understand it because it's too expensive.
Yep. And then, so if you go to My Social Security at any age, you can kind of see what you can
So I
get
can
at
go
what
on
age.
there, I can set up my own account, obviously name, I'm sure date of birth, blah, blah, blah. And then I can see where I'm at with my Social Security.
Yep.
And
See
in there
full
I can
retirement
say,
age, what you'd collect at
yeah.
whatever
So I
age.
can go in there and say, okay, I'm sure there's a portal, I can plug in my number and say I want to retire at this age, what's going to be my benefits?
Yeah, there's a little slider
Ah,
that you can actually just move.
another login. Just what I needed.
Yeah, I know.
Another password.
Yeah, believe me, you're preaching to the converted on that one. I have an Excel sheet with, it's just,
Oh, yeah.
it's unbelievable.
Yep.
You know?
Yeah, passwords. God, I don't even know how many I have. So bottom line, when I'm getting to be 63 to 64, I need to start talking to you.
Yeah, we can start having discussions. I mean, listen, I talk to some people, they call me at 65, they're like, what do I got to do? By the way, I just want to let you know, I'm working till 70, at least. And I'm like, then I have to ask them, well, what's your plan and this and that, and We'll tell you what you have to do and what you don't have to do. Like if you're a large employer, 20 or more employees, you've got a lot of people that they're healthy and they get on the HSA plans and put money away in the HSA, the health savings accounts.
Yeah.
If you go on Medicare, even Part A, which is no cost, you can't contribute anymore, nor can your employer.
Right.
So it depends. I'm like, hey, you on that plan? Well, you have to stop contributions, so I would just keep doing what you're doing and not worry about it. You know?
So bottom line, big picture, there's no fee for me to call David and say, David, this is my scenario.
Yep.
Can you help me? Does this make sense? You'll give me a no BS assessment on that. And if it makes sense to talk, you're going to send me a link. I'm going to fill it out, and then you're going to come to me, or I'm going to come to Hanover and meet you in the office.
Oh, we do Zooms. I do a ton of Zooms.
Or Zoom. We're going to meet electronically, and you're going to help me through this whole process.
Yep.
And is that usually more than one meeting?
It's usually two.
2 meetings?
Yep.
Okay.
It's usually a couple meetings.
And now I like what you have to say. You're going to help me. What is that? How does that work? How does that all? Will you walk me through the paperwork?
Yeah. So how it works is this, though. I kind of mandate that you have to sit with me for a 40-minute education. Like you have to learn what Medicare is, how it works,
Okay.
what your options are, and what the pros and cons
Now this
are.
is a one-on-one?
So one-on-one or one-on couple. I have a lot of couples.
Okay.
So
But it's individual to us, to our family. You're going to have that discussion with us about what this whole thing means.
Even though if I'm with a couple,
I understand.
they may be on two different plans.
I get it.
My education
is universal.
Is universal. Correct.
Okay.
It's the same.
So we're
one
gonna work with you to get that on. You're gonna come in studio, and you're gonna film that, so you can start sending it to your clients, so you can save 40 minutes a client.
This is true, but I've got to trust they've done their homework on that one.
Well, we're gonna show you how to do that.
Yeah, I've got to trust that they've done it because at the end of the day, the reason for the education is that I want them.
No,
to
I get
make
it. It's
the
a value
choice
add,
that's
and
best for
you
them.
want to be sure that they understand what they're doing.
Yeah, and I want them to make the choice.
Yeah, understood.
Now listen, some of the clients I meet with, I'll go through it and they're like, oh, you know what, I glassed over, you tell me what to do and I'm going to do it. But for the most part, a lot of people are like, well, you know what, like now I know what the pros and cons are and my options are. I can look at this differently.
Right.
And then we kind of look at it differently.
Okay. So there's a big educational component of what you're doing.
Huge educational component, yeah. You got to know how it works.
I still think you should record a session.
I'm gonna. You're
So
absolutely
you're welcome
right.
to come here and use the studio.
You're absolutely right. I'm going to, and I have to.
We're going to sit you right here. We're going to put your logo behind you. Actually, you sit up here. We got a camera set up now. You're going to sit in the chair, put the boom mic on you, logo behind you.
Yep.
And you're going to...
So how do I know they did their homework, though? That's the only question.
I've got an idea for you. We're going to talk about that off camera.
All right. I'll take it.
I got a plan for you.
Hey,
I'm just trying to help you out.
Because sometimes they sit with me, and I'll go over it, and I know I've gone over it. You know why? Because what I give for one person is the same one I've given 1,000 times, and they'll say, well, I never knew about X, Y, Z. And I'm like, yeah, I'm pretty sure I told you because guess what? I tell everybody. And that's on this slide. So, But it's fine. It's not meant for them to become Medicare experts.
No, I understand. But, you want to be informed. It's important, right?
Yeah.
If you don't have your health insurance, you're going to be in big trouble.
Yeah, because then if you pick if you're in the wrong plan, and a lot of people get angry. Hey, I'm in the wrong plan. It's not necessarily that you made a bad choice. It's just that things have changed.
Sure.
And you were unaware.
So I got to wait a whole year to fix it, though, right? Is what you're saying?
No, actually, there's different break glass in case of emergency situations.
Okay. So you can help someone that's in a wrong plan.
Yeah, sometimes.
Okay.
Sometimes.
But what about, now that this open enrollment's coming, can you fix a lot of bad things in open enrollment?
Annual enrollment, I can fix some things. So there's 2 enrollment periods, believe it or not.
Oh, okay.
There's the annual enrollment between October 15th and December 7th.
Yeah.
So that'll be heavily advertised. And people like myself and insurance companies are going to mail, call, everything else. Then that ends. All the plans go in effect January 1st. Then there's actually an open enrollment period from January 1st to March 31st.
Ah.
So guys like me and the insurance companies, we can't advertise it. nor can we reach out to people and say, hey, how do you like your plan? Do you want to change it? But if you, Buzz, said to me, you know what, I don't know about this plan, David. Can we do something? Then I can react to you. And
Okay,
we
so
can
if I
change
start
it.
the conversation, then you can help me.
I can be reactive, not proactive.
Understood. Okay. This is tricky stuff.
There's a lot to it.
Yeah. It's funny when I was reading your notes, I'm like, honestly, I don't know anything about this, and I probably need to sit with him.
Now you are.
No, but one-on-one, for real.
Yeah.
So that's good stuff. So anything else that we need to cover?
No, I would say that I help people with Medicare. I also do individual insurance too. So for that demographic, that's 58 to 64, and they're like, I hate work. I just want to be done with this. I think I'm financially good, but I have no idea how much health insurance is going to cost me. Then I want to talk
Also,
to
someone
those
that's
people.
maybe retiring early is what
Yeah.
you're saying.
Yeah.
So you can get them in a plan pre-Medicaid care, and
Medicare.
then switch them over to Medicare after.
Correct. Yep.
That's interesting. And then obviously you work very closely with people like Patrick and other, elder law attorneys.
Yep.
And so that's, you become their expert on that side of the house for Patrick and other people like that.
Yeah, and a lot of times I'll need them too.
Sure, absolutely.
Because
Yeah.
they veer off, and and it's like
Yeah,
we're not talking insurance anymore.
Yeah,
Now
yeah.
you need
Yeah, exactly.
you
And
know,
so you'll say, okay, tell me your
hey-
story, and then say, I'm going to give you some names to speak to, and they're going to help you with this part of the problem, and I'm going to work on this
Yeah.
part of the problem.
Yeah.
And that's why I tell everybody, you've got to have a team. No one person's going to help you with all this stuff.
No, because it'll start as an insurance conversation,
Mm-hmm.
and then they'll step into a different purview.
Yep.
And I'm not an expert there, but I know one. But
Right,
like,
exactly.
You know,
Yeah.
hey,
Yeah, but that's
that
the,
isn't
so
my
that's the
expertise.
point of that conversation, or the point of that comment was, and that's why you need to go to people that you know and trust, because they're going to then be able to refer you to people they know and trust that's going to take care of your next problem,
Yes.
or the problem you didn't even know about.
Yeah.
During that discovery process, you're going to say, hey, have you thought about this?
Yep. Exactly.
And they say, gee, no, why? And then you say, well, I think you're exposed here, and here's why.
Yeah.
Yeah,
That's
yeah.
exactly true. Yeah.
That's good stuff. Well, I learned a lot.
Good.
Yeah.
Good.
And I think this will be a popular episode. Obviously, a lot of my demographic are people in that age, so that's good stuff.
Quite honestly, that's the most satisfying thing that people say to me at the end of the education is like, hey, I really understand this a lot better. You know, like I said, no one's asking you to be an expert, but if you have a foundation to understand it, then we can help you make decisions and everything else. And to me, that says, all right, I was able to take something that, as you can see, can be very complicated and nuanced, distill it down to some choices, and then I will help you navigate to make sure that, like, hey, we can't do, like, hey, can we do A, B, and C? No, because of this, or yes, we can do something like that.
Yeah, that's good stuff. That was good. That's a tough subject to make interesting, and it was very interesting.
Good.
Yeah.
Good.
That's a wrap for today's episode of the BuildX podcast. Thank you, David from Senior Health Insurance Advisors, for joining us. We're going to put his contact information in the heading and in the description. Please subscribe, like, and share if you've enjoyed it. See you next week. And remember, just build, baby.
All right.